Jake Klein. I'm with OKC Kids Urology in Oklahoma City. We're going to do a short educational video or a training video on the advantages of bladder irrigation. We're going to show you a very good technique. Bladder irrigation is performed because when people do clean intermittent catheterization, which means that they're passing a catheter into the bladder via the native urethra or potentially a catheterizable stoma, those bladders will introduce bacteria when you're doing that catheterization process because it's a clean technique, it's not a sterile technique. And so those bladders become what we call colonized with bacteria, which is a normal part of any catheterization program. The challenges are trying to find methods to control the colonization because it can make the urine cloudy, foul smelling. You can have bladder discomfort if you get a significant urinary tract infection, fever. Those are some of the symptoms that you can experience. A lot of sediment and debris, mucus buildup, and these are just methods to help you control the colonization, reduce UTI problems, stay away from bladder stones, be able to manage mucus well if you've had a bladder augmentation. And so we're just going to show a few techniques on the advantages of that. And just remember, with colonization, bacteria like three things. The bladder provides a dark, warm, moist environment, and as we all know, bacteria love those three things. The fourth thing that bacteria need to really cause problems with patients that are on CIC is time. And so if you're cathing every 6 or 8 hours, you're giving the bladder extended amounts of time with the dark, warm, moist environment. And that can lead to more colonization problems and make it more difficult for you to manage that situation. And so one of the advantages is squeezing your catheter times shorter, like 3 or 4 hours, because after about 3 hours, bacteria start to really multiply quite a bit in the bladder. And as you can imagine, overnight catheterizations, if you're not cathing through the night, well, that's 8 or 10 hours that you're sleeping, and so often the morning urines can be very thick, cloudy, maybe smelly. And so we're going to show you some techniques. You're going to need a few things to do the bladder irrigations. Of course, you're going to need your catheter. And what we're going to use is we're going to use a large catheter so I can show you the eyelets and the features of the catheter. This is a 16 French. It's a male style catheter. It's 16 inches long. It has a funnel end. It has laser cut eyelets on the end. And pretty much all catheters that are what we call kind of a dip and jelly type catheter, not a self-lubricating, are going to have these same type eyelets. You're going to need some irrigation solution, and you can use sterile saline, which is 0.9% salt water. You can also use sterile water, but again, remember the bladder environment is not sterile. And so we went through a shortage of being able to get sterile saline and water due to supply chain issues during COVID. Everybody experienced it. So I have many patients just using over-the-counter distilled water, which works just as well. And you don't have to have it ordered and sent to your house with your DME supplies, so there's a little advantage to that. Plus it costs $1, so it's very cheap. The next thing you'll need is a basin to pour your irrigation fluid into. I always like to use just a stainless steel bowl. You can buy these at Walmart or any small store for 99 cents. Stainless steel reduces bacterial growth. It's easy to wipe out and keep clean. And then you have a designated basin to put your irrigation fluid in. You'll obviously need some lubrication, some KY jelly for your catheter, either in a packet or a tube, whatever you use. Some people may need a catheter plug. If you're going to use more irrigation fluid, you can always cap that off while you get more fluid. So that's a potential item that you may need. And then you're going to need a 60 cc cath tip syringe, which looks like this. It holds 2 ounces and it will adapt very nicely to the end of your catheter. There are also closed system catheters that have a funnel end catheter inside them, and you can cut that off with the bag system and still irrigate without having to use another catheter.